Well, we know that the strike action has been embarked upon by the Ghana Medical Association, still biting hard, still eating into the ailment or the inability of the population to get access to adequate health care across the country. We've been giving you a gist of what really transpired in the Ashanti region and across many of the health facilities in the region. But this is also pervasive in all the regions of the country. And so would want to get an assessment of what the situation is in as many regions as we can before we wrap up for the show this morning. And now let's go to the central region.
We'll go to the central region. We're joined by our colleague Richard Kwejo there. Richard, good morning to you. What's the situation in the central region?
Well, I have visited about 3 of the health facilities in the central region. I've been to the Cape Coast Teaching Hospital, and there I went to the major unit. I saw doctors working on patients. When I inquired, they told me that these are patients that were brought some days, and so it's their duty to care for these patients. But in the OPD, we are not attending the patients. But the patients seem normal because there were other junior doctors and other paramedics who were attending to them. As usual, the OPD unit, even though it was not filled, but on a normal day, the strike had not been there. That place would have been filled, but the population there wasn't that huge. I went to the EIS clinic, that's the private clinic, but that other place, the place was filled in rapid. A lot of the patients had gone there because they would have access to the hospital. Because these doctors who work, some of them work at the government sector, but they also double up working at the private sector. I went to the University of Cape Coast, and the situation was the same as was at the Cape Coast Teaching Hospital.
Okay. All right, Richard, we thank you. Thanks a lot for the updates. That's our colleague in the central region, Richard Kwejo Nyako. We know about the situation in the Ashanti region, at least some parts. We brought you earlier the story of this woman who was sent to the Komfanochi Teaching Hospital, but obviously because of the action by the doctors, we know it's entered into the week where they are not attending to emergency cases. She was turned down, eventually died. Sadly, we brought you that. You know, we have to go somewhere else.
And would want to just give you a preview of that video again, and you get to see a vivid description of what we're trying to tell you as to what really is existing in terms of what the scenes, the medical facilities are facing, because many of them have been inundated with a number of patients across the country, and because, well, the remaining personnel usually will be the other paramedical staff, not including the medical doctors. They are not really able to resolve the situation, and you could see looking on pathetically, not able to do anything, are the relatives of who the body or whoever is on the stretcher there. You can see that that person really has passed on, we're told, subsequently following those reports. And these drawing tears and a lot of just a somber reflection among those relatives who tend to bring a lot more of their patients to the hospitals, as many of our correspondents have been reporting. But this is what you need to do. We have the Facebook platform, Joy News on TV, and so if you have scenes like this, you've recorded either on your tablets or on your smartphones, you can also just make sure you tag the Facebook page, Joy News on TV, and then just narrate to us a little bit in 2 or 3 succinct paragraphs what the scenarios are, where it happened, and what the reaction of the relatives who may have brought the patients there, and even the reaction of the paramedical health personnel remaining at that very health facility you're talking about. So we'll be very much grateful to get some of those thoughts. And we'll try and get a lot more of your reactions, as they have been coming in on our Facebook wall, Joy News on TV, which has a connection to a platform on Twitter, Joy News on TV. And so some of those messages, if they're ready, we'll try to relay them to you, for you to always know that we're always in the communicative mood with you. We have a channel on YouTube, and My Joy Online is a channel. We have thousands of videos uploaded there just for your benefit. But again, if let's say you're a patient, you're watching us this morning, you're at one of those health facilities, you would want to communicate with us, I think we'll be very much glad.
All right, I'm pulling up some of the messages and then I'm going to share. Because earlier, you know, we brought pictures and we have it on Facebook of how the surgical units of the Korle Bu Teaching Hospital is looking like this morning. That's generating a lot of comments on Facebook. And Mascot is asking, please, do we know doctors are not the only people who work in the hospital? Nurses are trying their best to stabilize the condition. Okay, so let's not pretend without doctors the hospital will never function. Mascot says so. Hussein Razak from WA, the public outburst on both doctors and the government is rather escalating. The flames' lives are irreplaceable and some sicknesses may worsen. So let's speak with calm. Prince Osei Asante says, though the demand of the doctors are too much, the government and the doctors should come to a point of agreement. Thumbs up to all the nurses across the various hospitals and polyclinics. Prince Osei says so. Somebody writing, putting a lot of, you know, a very long one, which is almost like an email, but keep sending the messages on facebook.com/Joy News on TV. We'll cross over to the Volta region now. Let's speak to our colleague Ivy Setoji. Ivy, what's the situation with the public hospitals where you are?
My check reveals that they are still working. Emergency services have not been withdrawn yet, according to what I've heard and what I've said. Apart from Go and some other places, that's from Wo upwards, they have withdrawn the emergency services. I spoke to some doctors earlier on who told me they have withdrawn the emergency services because of the media hype that they were not working, and so they were forced to do that. But some hospitals are still working. They are still attending to emergency services. I can remember a little boy who was knocked down 2 days ago in a critical condition. He was attended to, and the doctors are still attending to him. And so some of the hospitals are still attending to emergency cases, and some are not.
All right. Ivy Sotoji, our colleague there, thanks a lot. We know the situation in the Volta region as well. So we know the Central region, the Ashanti region, the Volta region. And there's something interesting that I'm picking on myjoyonline.com that Dr. Charles Rekobrobe is saying. All doctors who work in public hospitals or employed in the public sector must cease all forms of industrial action now and return to full patient care as stipulated under their contracts of employment. They must simultaneously order their negotiators to engage their employer, the government of Ghana, under the mediation of the National Labour Commission for the 2-week period stipulated under the law. Each and every doctor who feels so inclined must serve a notice of resignation of employment stipulated in their letter of engagement and duly resign from the public health service if not satisfied with the outcome of the negotiations between government and their leaders. And he says, everybody else, from President Mahama to Stan Dogbe to Kwabena Japan, from Chairman, and he keeps mentioning lots and lots of names there, to shut up and stop whipping up public sentiment for or against doctors as if what we're confronted with is a theoretical debate for which the only thing that matters is the cleverness of the competing sound bites. Amazing. That's from Tarzan, coming hard, strong, but straight to the point on the doctors. He says that you have no right to go on an action like this. If you want to resign, give us the letter, give us that notice of resignation, and resign. You know?
Yeah, definitely. And my position is, I don't think the doctors are some of the worst people, even averagely paid, as far as in their category of work that they do in the country, yeah, but even across the sub-region. So, well, we have put ourselves in this very state. If you look at the ratio per patient of the medical doctor to the normal population, we haven't done well in churning out the lot. Each of the times when the result for those who qualify from the sciences into medical school comes, we only get to select even less than 1% of those, just because they have the highest grades, and also because the facilities we have can only take so much. So we have doctors who would go to Ukraine, that is if they can afford. We have candidates who have to go to China, and now they go to the rest of the Scandinavian countries, Cuba, or even the Balkans, and go to Cuba. And for those who go to the rest of Europe and the United States, will not even come back, so to speak. But those who will come back, even given tough time trying to settle in as medical doctors. So we have ourselves to blame. Do we have a strategy of training medical doctors? The Cuban medical doctors are not the richest people in their country, but they are the most passionate and they want to serve people. What difference is there if you're a medical doctor from, let's say, somebody who is a trader in the market or a farmer, so to speak? I'm not saying that the learning trades are the same. They are not. But I don't think that you're saying that you're paid equally as somebody who is a farmer or somebody who is an agriculturist, so to speak. You're paid well better. That's what I feel.
Let me take some more messages on Facebook. This is Bewa Alex saying, this is getting serious. May God help us all. Nan Thomas says, what is the president saying about all this? Is he ready to negotiate at all? Whatever happens to Ghanaians with regards to health is caused by Mr. President. That's Natoma Muhammad is saying. So Ali Muhammad says, hey, Ghana, when? Allah have mercy on GH. Kamal says, if we die young, doctors should bury us hard in a cave and lay us down flat to commemorate their wickedness on Ghanaians. A lot of people going really hard on the doctors. CKD Legend says very, very bad. Yaudo says, okay. Michael John Kofi says, what the need again? Ray says, if the nurses go to job and no work since, okay, yeah. A lot of people linking this to different things. Sad to say, politics has also set in. There's good amounts of patients waiting for treatment at the physiotherapy department. I wonder why they didn't go there to take images. Nana Aisha. Okay. So you can, send your messages, keep them coming through, and get the conversation going on facebook.com/Joy News on TV. Ketsi Airtel will bring you some entertainment here on the AM show. Please do stay with us.